Good afternoon, and welcome to Season 2, Episode 11 of the Home Healthcare Today show. It is the month of June, and June brings in, of course, the summer months and lots of humidity. All right, our very special guest today is Dr. MeiLan Han. Dr. Han is a professor of medicine and chief of the Division of Pulmonary and Critical Care at the University of Michigan. Dr. Han is also an author of a new book that we're very excited about, titled Breathing Lessons, A Doctor's Guide to Lung Health. Dr. Han, welcome to our show today.
Oh, thank you so much for having me.
Doctor, do you mind elaborating a little bit more about yourself? I gave a very brief introduction of you, but I'm sure listeners as well as viewers of our show would like to know, who is Dr. Han and what is your passion for patients, students at the University of Michigan and beyond, and passion for lung health and Metro Detroiters?
Yeah, so I've actually been in Michigan since 1999. I
Wow.
did my med school and residency out at the University of Washington, Seattle. When I came out here, I thought it would be sort of the short stint and then I'd end up back in the Northwest, but I ended up marrying a native Michigander and have
Very good.
been here ever since, and in fact more of my family have moved out here, so it's a village now. But so I've been at the University of Michigan since 99. I started my residency and fellowship here and then stayed on faculty.
Okay.
I recently took over as chief of the division at the beginning of the year. It's been a difficult time, I think, for almost all pulmonary divisions across the country because of the
Yes.
pandemic.
Mhm.
So, but I'm really, proud and happy to be able to get to serve the group of doctors at the University of Michigan. I have taken care of patients myself for a long time, but I also do a lot of research, particularly into chronic lung diseases like COPD.
Yes.
There's some cool imaging applications that I've been working on investigating. But in the last few years, I'm
Yes.
also a spokesperson for the American Lung Association, and so when the pandemic hit, I realized that there was sort of this crisis of information. A lot of people,
Yes.
all of a sudden, lungs were failing, people were ending up on ventilators, but nobody really understood what that meant.
Right.
And so that's what ultimately led me to write the book. And the goal of Breathing Lessons was not just to explain to people how their lungs work, although that's really important. I feel like if people understand something, then they can be better partners in their own health.
You got it. Yes.
It was also to help them facilitate conversations with their doctors, but there's also a lot in the book about, and I know we'll get into it later in the show, but also a lot
Sure.
about, how to protect yourself and your kids and your families over a lifetime, which I think, as you know, as physicians, that's not something we spend a lot of time talking to our patients about. We don't really have time, unfortunately, a lot of times in the office. So, and it's often, to be honest, not something that we learn a lot about in medical school either. So
Right.
I spent a lot of time, kind of researching and trying to message. And so for in the last few years, that's sort of become a passion of mine, is just trying to um, advocate,
Yes.
for patients and to try to get more good information out there.
Absolutely, Dr. Han. This is very good. Well, we're glad that you chose, to stay in the Michigan area. So glad of that. And we're able to, course and bring more family members to the great state. We're also appreciative of the research that you've been able to conduct and the years of taking care of patients and now leading faculty at the University of Michigan. You hit on some major points about information and that lack of clarity whenever it comes to knowing about lung health, knowing some of the best practices and some of the things to avoid throughout one's life to ensure a better chance at having healthy lungs and the like. With that being said, if you don't mind giving us a few golden nuggets from the book, Breathing Lessons, A Doctor's Guide to Lung Health, Dr. Hahn, what inspired you to read it, and what are some key things that readers should walk away with?
Well, there's a lot in there.
Yes.
But one, for patients that already have lung disease, there's a lot in there about what kinds of things to talk to your doctor about.
Yes.
For patients that aren't sure but are thinking maybe they do need to see a lung doctor, there's a lot of information in there about the kinds of tests to ask for. Unfortunately, we do a really bad job in this country of screening for lung disease, and we have millions of undiagnosed patients. And that became even more clear to me during the pandemic when we saw excess deaths. And I think a lot of those were actually related to people that had lung conditions who didn't know it.
Yes.
And then we've all of a sudden it seemed like a surprise that some people were getting really severely sick. And I think actually some of that could be explained by having undiagnosed lung disease in the first place. But then there's also a lot in the book about how you protect yourself and your families. And I think people might be surprised to know that the lungs don't actually fully develop until your mid-20s. And so I think it's helpful to think about lung development in 3 phases. That's what happens sort of before birth, what happens as you're getting those lungs to try to get them to their full potential, and then what happens afterwards. One of the things that we've learned in the last few years as a medical community is that we had sort of this misconception. We had this misconception that most people entered adulthood with healthy lungs, and then if they had something bad happen to them, or they smoked, or were around, a lot of dust or coal mining or something like this, they would get lung disease. But it turns out that when we look at data from studies, that a lot of patients, or a lot of people really, probably do not actually hit full lung, sort of their predicted lung size. And I think it's really surprising for doctors because, we don't ever test kids to see what their lung function is. We don't routinely test adults. Usually only until much, much later in life that we check. And so when they were doing studies where they were just following people as part of a study, I think we were really surprised to realize that there's all sorts of trajectories. And so, as a parent, I would be concerned if my child was falling off on a growth chart, right? We don't map any of that. So we as parents have no idea if our kids are on target or not on target. So since we don't know, and a lot of times doctors aren't checking, my mantra is you've just got to be mindful as a parent, as an adult, and think about all the things. So what are those things? Well, for pregnant moms, that actually means that staying away from nicotine exposures as well as air pollution is really important. Even the maternal exposure can impair fetal lung development. Prematurity is a huge risk factor for lung disease, and we're able to save babies at younger and younger ages. My own son was born prematurely, but it also is a risk factor and something as a parent to be aware of. So getting good prenatal care and pushing, doing everything you can to carry babies to term is really important. And then, for kids, it's common sense, things like making sure they get immunized against some of the common childhood illnesses that can cause pneumonia. But it's also thinking about how to protect kids from both indoor and outdoor air pollution. And there's actually some data, for instance, that kids that grow up in urban environments or even schools that are near freeways, that constant exposure to air pollution can impair lung function that actually can improve if the kids are moved away from those areas. So schools can adopt things like anti-idling policies, or cities can be mindful about where they build schools. And you as a parent may not be able to control maybe the city you live in. You've got a job and, but you maybe control where in the city you live. Maybe you could even control, let's say you're in an apartment building. There are some apartment buildings that are much stricter about things like smoking, which gets
True.
across, it's in the central, ventilation, as much as we like to think that it's not.
Right.
So there's a lot of things, just, and then middle school and high school, before the COVID pandemic, we were in the middle of a vaping pandemic, still are.
Yes.
So, the list goes on, but,
Yeah.
just, I think the one of the key, messages is that there's so much stuff that happens before adulthood
Yes.
that we have to be mindful of. And then, of course, all the stuff, that happens in adulthood as well, including both indoor and outdoor air pollution that we don't, maybe we don't think about. I think we all say, well, it's just the smokers, or it's just people
Yes.
like that have dirty jobs, but really there's a lot of other people that are also at risk.
Absolutely, Dr. Hahn. Dr. Hahn, so in thinking about those levels of lung development as a embryo through being a toddler, a child, adolescent, teen, and you said all the way into your mid-20s, there's stages of lung development. All right. So as we think about those various stages and people at different ages, when should a person, I guess, be maybe concerned in the event that they find that, hey, my child is out of breath a little easier than others or gets winded quicker? Is that a matter of physical fitness? Or should, parents kind of, look into, hey, is my child asthmatic, right? Or does my child have any other type of lung illness? So what are those key triggers or
Right.
indicators in your opinion?
So I would
Yes.
say anytime anyone, child or adult,
Yes.
if you're more short of breath than your peers doing
Yes.
regular, you're golfing with your peers, you're running with your peers, whatever age that is, if you feel like you're more short of breath than everybody else and you can't keep up,
Yes.
that's a sign that you should at least get checked out. Coughing, wheezing. Another
Yes.
thing that gets missed are frequent respiratory infections.
Yes.
That settle in the chest and take forever to get better. If you have a child or you're an adult and that seems to happen way more to you than to
Yes.
anybody else, that can also be a sign of some kind of underlying lung problem that's making you more susceptible to every virus, et cetera, that comes along. So unfortunately, one of the reasons for me for writing the book was we as physicians tend to get really busy,
Mhm.
and the public often isn't adequately educated, and there's this disconnect. So these conversations are not happening and the appropriate testing isn't being had. So I
Yes.
was thinking, by bringing the message to the people,
Yes.
so
Indeed.
you can start having those conversations with your doctors. Don't ignore the symptoms. Talk to your doctor. And one of the most basic tests to ask for is something called spirometry, which is lung function testing. And that is
Yes.
a great way to screen. We may need to do more studies. Sometimes we do CAT scans and fancier tests, but it's a
Yes.
great screening test just to see if you're in ballpark for where your lung function should be at.
Absolutely. Very good. Very good. And we will encourage, definitely, Dr. Hahn, we will encourage listeners and viewers, to have those conversations about screening, and tests. Some are a little weary of their insurance plans, wondering will their insurance do this, that, or the other. But we encourage them to talk to not only their plan provider, but talk to their primary care physician, right? And express those concerns, and we'll fight the insurance companies later. Let's not worry about that, but definitely seek the necessary screenings and attention.
I will say I have been contacted by patients and providers
Yes.
many times saying we're worried if something like spirometry would be covered. I think it's very rare.
Yes.
You have a patient that's really got true symptoms
Uh-huh.
for insurance to at least deny a basic, one-time spirometry. I've seen them complain about ordering it too many times, but really once, it's when you look at the costs of tests, probably, a fifth the cost of a more expensive CAT scan, et cetera. There's no radiation
True.
exposure. So generally, I have not, I mean, everyone's got a unique situation, but it's unusual for it not to be covered.
Very good. Very good to hear. One more question, Dr. Hahn, prior to our commercial break here. The lingering effects of COVID-19, right? And as much as we would like to put the pandemic behind us, we realize that we are still in it. And this is year 2.5, if you will, of us battling and struggling with the COVID-19 pandemic. What are some of the lingering effects that you're seeing as related to lung health for patients and families?
Well, one thing that I actually wanted to mention about the COVID-19 pandemic in general before I move into that, because this is a Southeast Michigan, show,
Yes.
is the fact that, one of the things that really upset me most about being a Michigander and trying to fight for patients with lung and breathing issues is the fact that we saw sort of a disproportionate number of deaths from COVID-19 among some of our minority communities,
Yes.
particularly our African-American communities in Detroit, et cetera. And so there's been a lot of research to try to understand why that is. People thought, well, maybe we aren't messaging the Black community enough in terms of vaccinations, but a lot of the research suggests that it probably relates to not getting as good of care as people should have in more chronic health conditions before the pandemic even started.
Yes.
And so I think when we think about recovering from COVID, it's got to be holistic, and we have to sort of, as a human body, have to be firing on all cylinders. And so what we're seeing for patients that are recovering from COVID is a huge variety of stuff.
Yeah.
So we have some patients that had really severe lung problems that are continuing to have, lung problems. We have some patients that had sort of this smoldering inflammation that just keeps causing problems as things goes on. Yes. And then there's other patients who probably are over the initial insult, but the initial insult was so bad that they got deconditioned, or other aspects of their health, their diabetes, et cetera, got worse. And so, it's something, that we have to kind of look at the whole person and try to make sure each little piece is optimized. There are many places, I'm sure, in the Detroit area, as well as, in Ann Arbor, that do have centers that help to specialize in patients with long COVID. But what I would say is, if we've got any listeners out there that are struggling with symptoms, of course, talk to your primary care doctor, but don't hesitate to be asked to get referred to a specialty center, either one that has a lot of different kinds of doctors, or at least to someone that is an expert in the area that your physician thinks is a problem. So for instance, at the University of Michigan, I'm a pulmonologist. We have providers that are specifically there to see patients with lung problems with long COVID, right? So and I know that's the case at other hospitals in Detroit. So that's just an example. And it is worth talking to your doctor and fighting to get those referrals so you can see a specialist and try to get to the bottom of it as best you can. But what I will say also, unfortunately, is that this is still an area that's being actively researched. And there are still patients where, despite us running every test in the book, we don't fully understand why they're still having symptoms. And that's something, as a medical community, we're still trying to get to the bottom of.
Absolutely, Dr. Hahn. Well, Dr. Hahn, I certainly personally as well as professionally appreciate the sympathy as well as the empathy that you have expressed for Metro Detroiters and Black and Hispanic communities that were disproportionately negatively impacted by COVID-19. And then focusing on not just vaccinations or some of the reluctance to be vaccinated, but you also honed in on some of those underlying health issues and challenges that may have gone without being seen or attended to in the life of a patient. So that's critical information. And I also want to add the comorbidity challenge or comorbidities issue where no one wants anything to be wrong with them, right? So in a lot of cases, we find where patients and families minimize what's going on. Well, it's just my blood pressure, right? It's just a little congestion. That's all it is, as opposed to being, a little more exploratory, a little more comprehensive, as to say, there could be a number of things going on that could be treated by various specialists within a system of healthcare, whether it's our partners at Henry Ford Health Systems or Beaumont, or even University of Michigan has a lot of specialty offices in the Metro Detroit area.
I get it. We screen a lot of patients for lung disease and as part of clinical trials even. And I'll have patients, we've had patients that'll call and say they're interested, but they're scared.
Yes.
And I think people don't want to lift up. I get it. I get a mammogram every year and don't love it.
Sure.
I always cringe a bit when I'm opening up those results. I get it. Sometimes it's nicer to keep your head in the sand.
Yes.
But I do try to remember that it's not just about me.
Right.
I have a family, a lot of other people that depend on me.
Yes.
So
that's right.
Trying to, keep it together for everyone else. And there are, of course, we're all scared about the really scary bad things, but I would say those are just not as common. The more common things are the common things like blood pressure and diabetes, the stuff that we actually have pretty good treatments for. Even, some of the chronic lung diseases have got some really, we've got good medications that can stop flare-ups and things like that. So I would say for the majority of things, even if you do find something, it's probably something that's potentially treatable, even preventable, and better to get on top of it early. But I totally understand sort of that human nature piece of, do I really want to know?
And we say, yes, you do. Yes, you do. Wonderful. Now we're going to go to a quick 30-second commercial break here from our sponsor, American Advantage Home Care, and then we'll be right back for a few more questions.
As Americans, we're defined by our grit, our toughness, our excellence, and our multiculturalism. But here in Detroit and Southeast Michigan, we are battle-tested. That's our advantage. We've been hit rather hard by the pandemic and other health challenges. Allow American Advantage Home Care to provide skilled home care services for you in the comfort of your own home. We are Joint Commission accredited and CMS certified. Call us today.
Welcome back to Season 2, Episode 11 of the Home Healthcare Today show. And we are talking about lung health in this special episode as we enter into the summer months of June. We're joined today with Dr. MeiLan Han. All right, Dr. Han, a few more questions. Thanks for all that wonderful insight in the first half of our segment. All right, as we pick up where we left off, talk to us a little bit about your research in layman's terms. I believe you alluded to some of it early on in the interview, but let's circle back to research. What are you currently working on that you're excited about? And then maybe some of your past research milestones.
Yeah, one thing that I've been working on for a long time with some other researchers at the University of Michigan is trying to develop tools to identify and characterize lung disease better. And so using CAT scans, they've developed some software that we actually now use at the University of Michigan. So a patient, if you've ever had an X-ray or a CT scan and you've looked at it, it looks like a bunch of black and white.
Sure.
And so we can take those images and turn them into color images actually for the physician so that they can see in 3D space what parts of the lung are healthy and not healthy. And it tells us who's at risk and helps us plan for surgeries and things like that. So that's one thing I've been doing for a long time. But honestly, some of the research that I'm most excited about in the last few years is taking some of those same techniques and applying them to younger individuals to try to figure out, where does lung disease start? At what age? we've always studied the patients we happen to have, and those are always the 50 and 60-year-olds.
Right.
But we've realized if we want to understand where lung disease starts so that we can stop it,
Yes.
we can't study the 60 and 70-year-olds. We have to study the 20 and the 30 and the 40-year-olds.
Right.
So a lot of my research now, in fact, if there's any listeners out there, we have multiple studies recruiting at the University of Michigan through the National Institutes of Health and the American Lung Association, where we're doing screening CT scans on essentially 25 and up.
Wow.
So we're bringing those people in and getting breathing tests and CT scans because, like I said, no one else is getting them.
No.
Physicians aren't ordering them. They're not being done. And so until we go and prove that there's, kind of a need and there's stuff going on there, it'll be harder to convince people that we need to start doing this. So that's a lot of what I'm doing right now, is just trying to understand where lung disease starts, how it starts, how can we identify which people are at greatest risk? Can we use things like CT imaging to try to find early areas of lung injury? So that's where a lot of my focus is right now.
Very good, very good, and helpful. I do appreciate the preventative measures and the preventative approach of saying, let's scale it back and look at when and where and how lung disease is developed, and are there ways to alter those or derail those impacts of progressive lung disease with getting earlier patients, or earlier research subjects, right? Research human subjects involved in the process. Okay, breathing apparatuses, I've seen where our even the tanks, the oxygen tanks that we use for our patients have changed greatly over the years, right? As a home healthcare provider, we're often tasked with working with durable medical equipment companies to ensure that people have the right devices. What have you seen, Doctor? Devices and breakthroughs as related to patients with lung health challenges and issues?
Well, probably one of the biggest changes that we saw, which was during the pandemic, was the use of high flow nasal cannula oxygen for patients that were in the hospital. This is not something that we maybe had done quite as much, but we found that many patients with severe COVID in the hospital could avoid having to go on the ventilator if we use these special devices. And so there are a lot of companies that are working right now on how can we figure out how to deliver more oxygen at home? How can we make it more portable, easier for patients? Some patients, we've seen an increase in use of ventilator support within the home in the last few years.
Yes.
Where people don't need just the oxygen, but they actually need some device that blows some of that air in for them, whether that's hooked up to a trach or just a mask that patients put on at night, for instance. There's, kind of more research in that showing more benefit for more patients. But at the same time, we all know that particularly if oxygen is hooked up to one of those devices, that is a lot of equipment.
It is.
And so a lot of companies are working fast and furious to make those devices smaller, more portable, just easier for the home environment. And so I think in the next few years, we'll see sort of a next generation of devices. I think the biggest breakthrough a few years ago was sort of the portable concentrators, right?
Yes.
So, and we were all happy that they were sort of the size of a vacuum cleaner, and those continue to get smaller. But I think we're going to continue to see, like I said, the ability to do even more oxygen portably at home, and just ventilators that are, more portable, smaller, everything a little bit easier. I think it's probably it may take for some of these devices a few more years still, but I think that's definitely the direction that the field is moving.
Wonderful, wonderful to hear it. And yes, we talked about homebound, Dr. Hahn, the homebound community, city of Detroit, according to Detroit Agency on Aging, reported that there's about 40,000 homebound Detroiters, right? And that's about 8% of Detroit's population, right? So when we think about homebound patients, quite a few people, Obviously, home healthcare does help and assist in so many ways, and we're fighting to get respiratory therapy identified as a needed discipline for patients. But whenever it comes to caregivers in the home, as well as loved ones, how can they go about creating a better environment for their family member or their loved one whenever it comes to breathing and a safer habitat for breathing and protecting their loved ones' lungs?
Well, there's a lot to think about, but in the book, I do go through a lot of things that you can do to optimize the air within the home.
Mm-hmm.
And so there's some obvious things and some non-obvious things. So
Right.
radon is actually a huge cause of lung cancer throughout the country. So if your home has never been checked for radon, you can check with your local, county office on how to do that. But there's kits that you can do in the home and send away and get checked. But that's one thing, every home should be checked for radon. There are volatile organic chemicals are
Mm-hmm.
compounds that are found in just about everything that can cause lung irritation and lung inflammation. And there are some strategies to try to reduce the use of VOCs in the home. That includes, like, if you have to paint, use low VOC paint, trying to find more environmentally friendly cleaning products to use in the home. If you have to install, non-carpeted surfaces are better, but if you have to install carpet, you can actually ask them to be aired out before they're installed in the home.
Yes.
Some patients, I'll even recommend getting HEPA air filters. We all did this a bit more during the pandemic. I have one in our bedroom, at least, where I can kind of keep an eye on what the air quality is like, at least where we probably spend the most of our time, which is where we sleep.
Yes.
But there are actually other things in the home that can be harmful. Gas stoves, even cooking stove. I have a gas stove. I try to always hit the exhaust fan when I'm running my gas stove. Wood burning stoves actually, unfortunately, are a huge source of indoor air pollution, probably worse than anything else I've just mentioned. There are newer EPA friendly, that meet some of the newer EPA standards. So if possible, if you have one, you rely on one, try to move to one of these cleaner burning units. But honestly, even the cleaner burning units, even more optimal would be not to use one at all. But I get it. I had a wood burning stove in the home I grew up in, so I understand some people still need it. So those are just some common things I ask people to think about.
Okay, this is good. Very, very important information there. Absolutely, from the lowest to the even more extreme. So starting with those radon, checking for radon in the home, and then those chemicals. So as we think about even like cleaning solutions and the like, paints, common things that individuals do all season long. So I know we gave this episode the preface of the summer and humidity, but obviously as we go into the fall months and we crank those furnaces back up, we definitely want to circle back. We'll circle back, Dr. Hahn, and re-air this show in the November time frame to refresh people's minds and memories, right? Because now it's summer, I'm going to go outside, I'll barbecue, I'll be on the deck, etc. But folks are going to fire up fireplaces and furnaces in the fall. That's for sure. Dr. Hahn, last question for you. Besides a primary care physician, and then for patients and families out there that don't have PCPs, as a home health care provider, we try to identify and match families with visiting physicians who can come in or even do telehealth visits to get patients started with care. Where else would you suggest or identify families and patients should go to or look to in the event that they have some questions or concerns about lung health?
Well, obviously, you can always ask at any time. You can ask your primary care provider for a referral to see a lung doctor. You can also, depending on your insurance, of course, you can sometimes just go directly to a lung provider and ask for an appointment. One good thing about the pandemic, I think, for our homebound patient population is that virtual visits in Michigan are now sort of an ubiquitous thing. And
Yes.
we now, I do almost half my visits virtually now. So
Yes.
you can, even if it's not ideal, we try to get patients in for that new patient visit in person at least, but
Yes.
but sometimes circumstances dictate it's just not possible. And so we do, many providers, including, like I said, myself and other providers at the University of Michigan, and I know other Detroit area hospitals do a lot of virtual visits now. And
Yes.
we're also one key therapy for patients with lung disease has been pulmonary rehabilitation.
Mm.
And even that, which used to be almost exclusively brick and mortar,
Yes.
is now being offered more and more virtually as well. And that's an
Yes.
exercise program and breathing exercises and a little bit of aerobics and there are more and more programs, including, at the University of Michigan, we're doing a pilot virtual program right now, and there's just more and more resources for virtual options for that too. So I would recommend patients check that out as well.
Wonderful, wonderful stuff, Dr. Hahn. Well, hey, congratulations again on the new book, Breathing Lessons, A Doctor's Guide to Lung Health. And Doc, where can families find this great read?
Oh, well, thank you.
Yes.
You can, on my website, drmeilanhan.com, you can find everything related to me in the book, but you can also find it essentially at every major retailer, Amazon, Barnes & Noble, take your pick. It's available everywhere.
Awesome. Well, hey, Dr. MeiLan Hahn, thank you for all that you do, not only at the University of Michigan for faculty and students, but all that you've done for patients and with the body of research. And of course, this great learning book, the learning resource, Breathing Lessons, A Doctor's Guide to Lung Health. We appreciate you coming on our show today and spreading so much great information and knowledge with families as well as patients. And they could actually take heed to the advice that you have given to head down the road of stronger and better lung health. So we certainly thank you and appreciate you, Dr. Hahn.
Thank you so much, and everything you're doing for Southeast Michigan.
No doubt about it.